2016 is set to be another exciting year in healthcare, and on this edition of the eClinicalWorks podcast, we're going to take a look into some of those trends that we'll see this year and how they will impact the healthcare industry. I'm Siladi, and welcome, and we're going to be aided in our exploration by the help of Sam Bhat, Vice President and co-founder of eClinicalWorks. Sam, thanks for being here.
Thank you, Adam. Glad to be here.
So in order to know where you're going, it's sometimes important to know where you've been. So why don't we review some of the landscape from 2015. What are some of those big highlights from last year, and what made 2015 one of the most successful years for eClinicalWorks?
Yeah, you're right, Adam. In the last 16 years of eClinicalWorks, 2015 happens to be the most successful years in terms of adding new physicians to eClinicalWorks family. We added a lot of physicians and practices to eClinicalWorks. And one thing that we saw in 2015 is a trend where physicians that are using different EMRs are switching to eClinicalWorks. And 98% of them came from different EMRs to eClinicalWorks. In the process, when I look back, more than 40 different EMR systems were converted to eClinicalWorks. So that's a trend, what we call as Make the Switch program. And you probably have seen the Verizon commercials these days, and that's happening in healthcare.
Other big highlights from 2015, I think, are the chronic care management release.
Absolutely. As you noticed, CMS introduced chronic care management program towards the end of 2014. And in 2015, we introduced technology embedded inside eClinicalWorks in such a way to help the physicians efficiently manage patients enrolled in chronic care management program. We saw a significant interest among the physicians to use technology to efficiently manage the population. And we have many physicians that are now using that technology extremely well and efficiently managing the entire process. And beyond CCM, if I can just go into the population health a little bit more, patient-centered medical home, a huge success. And we have built this technology to help physicians achieve the level 3 recognition really quickly with eClinicalWorks. And last but not least, the HEDIS program has been very successful because of the fact that we have simplified the process of generating the required measures for different payer-based HEDIS initiatives. So all in all, I think a great year on the population health side in 2015, and we'll continue to see the growth in 2016 and in the future.
Certainly those programs have seen a huge uptake with their prevalence in the population health space, but another milestone in 2015 was that eClinicalWorks added a number of new Davies Awards winners to its roster.
Absolutely. I'd like to congratulate both organizations that received Davies Awards. One of them here in Massachusetts, Grow Medical Associates, and the second one is HealthNet from Indiana. And we've really done very well over the last several years. Almost every single year we've had a Davies Award winner that is eClinicalWorks customer. So
turning our focus towards 2016 and the future, which product lines are going to start receiving more attention going forward?
Well, 2016 is a year where we are going to see a transformation where physicians who are trying to use technology at the point of care, where they use electronic health records from eClinicalWorks, have been very effective and efficient within their workflow. But one thing we are seeing is a trend where you have to have an online presence for your practice. I mean, we have seen this everywhere else in retail industry, and no matter whether you've got a brick and mortar business, you've got to have an online presence to kind of offer your services. And that is now applicable to healthcare as well, because consumers are demanding access to health information as well as healthcare services being available online. So we are excited about that growth in 2016, and we have a product line that is very nicely designed called Helo. As you know, many physicians and practices are using that technology today, but we're going to see an increase in adoption of Helo, where they can offer services online. First of all, make themselves present in the online world, where patients should be able to discover physicians and practices. Once they find them, schedule them online, schedule an appointment online with those providers. And then thirdly, if patient is interested in a face-to-face versus televisit, patients should have those capabilities online. And we are going to see a significant interest in adopting online tools, both on the patient side as well as the physician side.
Sounds like Hilo is trying to bring a lot of those different advanced components to the patient and make it easier for them to find their doctor and find the services that they're looking for.
Absolutely. You need the technology that is ready on both sides, patients as well as on the physician side.
So you spoke about some innovations that focus on improved population health and cost reductions, but what role do you see employers taking in their employees' health, and how is eClinicalWorks working towards that?
A great question here, Adam. If you look at eClinicalWorks as a company, as an employer, 2 years ago we started this initiative to encourage employees to focus on wellness, because we know that prevention is better than cure, and as we believe in that, as a company we started this initiative called Hilo at Work. We wanted some technology development to help assist our HR department so that they can launch a new challenge, a challenge for a walk or a run or a weight loss program, whatever it might be. And today, eClinicalWorks HR department, along with employees, have been effectively using this technology, which is helping employees to get better and focus on wellness. And as we saw success in that experiment in the last 2 years, we realized that, and this is a technology platform that we can offer to our customers. And we have seen an interesting trend in the last 12 to 24 months, where many of our urgent care clinics that use eClinicalWorks EMR are opening their services, are opening clinics at an employer site to take care of different type of annual visits and sick visits and other needs of an employer. And those customers can take advantage of Hilo at Work and offer wellness services on top of their regular clinic services. And we see a lot of promise in that area. And it's an early stage, but we do see that we have the right product to help our customers that are offering these services to employer on one hand, as well as we have built an employer portal where employer can get access to all these capabilities for wellness initiatives. It doesn't stop at wellness. It goes beyond wellness. We also are interested in providing cost transparency to employees. As a result, employees can shop for the best pharmacy, the cheapest pharmacy, or a lab before they want to buy a prescription or get a lab test done.
Oh, and also important is giving the employee the ability to see how their care over the year fits in the spectrum of the spending across the organization, de-identified, of course.
Absolutely right.
Since its beginnings, eClinicalWorks has enjoyed high growth rate. Where do you see most of the growth happening now?
Well, we do see a growth happening across the board. We talked about the EMR and practice management growth. In the 2016 and beyond, we are going to see a growth in telehealth services. Telehealth platforms are now getting utilized by different physicians and practices, and we have the right technology at the right time, which we think is an area that we'll see a significant growth in 2016 and beyond.
So we've seen some dramatic return on investment from intelligent messaging campaigns. Tell me how our clients are using intelligent messaging to improve the health of their patients.
Well, intelligent messaging is very, very important to get your patients involved in your continuity of care. It starts by just sending a reminder for their upcoming appointment. It can be a phone call, automated phone call, or a text message, or an app notification. So that's the first step. The second step is you can start using intelligent messaging to alert patients for as simple as a flu shot, a reminder for a flu shot to increase your compliance levels. But now that we are seeing some trends where many of our customers have started using intelligent messaging for some unique needs. Let's take an example of, you want to create a new campaign for all the patients that are diagnosed with diabetes, but you want to send messages to only those patients whose hemoglobin A1Cs are way through the roof. And you want to send a notification to schedule an appointment with you or have a follow-up phone call or a televisit. And when patient walks into your office for in response to that, intelligent messages, you can enroll them into chronic care management programs and other programs based on how patients are, doing and managing their chronic condition. So there are going to be a lot of opportunities, and return of investment is going to be huge. One single text message can result into saving patients' life, number one, but also as a practice, you can start offering services that you have never thought of, leveraging today.
And of course, if any of our clients are interested in learning more about intelligent messaging, we've published several case studies on eClinicalWorks.com that you can go check out today. A hot topic in many industries today is the Internet of Things. How will it bring changes to the healthcare industry?
Well, if you look at a consumer today, consumers these days are interested in using their smartphone to control everything that is out there, including their thermostats at home or light switches. And why can't we start using that similar capability and bring that concept into healthcare? Let's take a look at some examples where this is probably applicable the most. If you are a diabetic patient and you would like to manage your blood glucose level over a period of time, you can use a glucometer that can wirelessly communicate with your smartphone app, Hilo app, that is on your smartphone. And Hilo will be able to download all those readings from your glucometer, number one. And once the information is available on the app, you can immediately publish them and make them available to your physicians. Or next time when you go to the doctor's office, you'll be able to share all those readings so that doctors can take better decisions and make better decisions. And we have done integrations with more than 25 different types of devices today, all the way from blood pressure cuffs to activity monitors and weighing scales to help patients take care of chronic conditions that they are trying to manage better than what they were able to do in the past. I think integrations with all these devices and a clinical rules engine is going to transform how the care delivery is done to manage chronic care services.
Well, certainly the promise is there for all these integrated devices, and we actually have a concrete example of a way that this has impacted a patient's life. So take a look.
My blood pressure was something that I've been working on for about 8 years now. I had given up caffeine, exercised.
He may have been taking care of himself, but he needed a lifestyle change.
When I visited Dr. Weinstock in my annual physical last year, my blood pressure was 10 points higher on my top number and 5 points higher on my lower number.
I was a little concerned. I realized that he was kind of going the wrong direction. So we made some adjustments and medications, said to continue taking your blood pressure regularly through the blood pressure cuff. That hooked to his phone, that connects into Hilo, and then transmitted that information to my desktop through eClinicalWorks.
Between the iHealth blood pressure and the Withings watch, and then all connecting through the Hilo website, Dr. Weinstock has the ability to see it at nighttime before I go to bed. If I take it in the morning, he can see it. I had been exercising regularly. I felt great. I noticed my blood pressure had been lower than it had been in a month. And then 31st of July, 7:30 in the morning, so I was just ready to go to work. And I said, oh, I feel that pain in my chest, heaviness in my chest, and sweating and some pain down the arm. And she goes, take your blood pressure. So because I had the equipment here, I went and I took the blood pressure again, looked on my phone, and it was 199 over 118. And I says, whoa. She goes, that's it. You're going to the doctor's.
He was able to realize, okay, I'm not feeling good, my blood pressure's up, I can't fool around with that. It made sense the emergency room was the appropriate place to go and not wait.
When I entered in, they took my blood pressure, was very elevated.
He could articulate to the emergency room, here's my record, here's my blood pressure from the visit, here's my labs from last week. It allowed the MERS to him to have a lot more information at the time he presented, as opposed to trying to figure out what was really going on.
And hopefully they could see what exactly is going on and be able to treat him faster.
Several hours later, the test came back where the enzyme showed that I had had some type of mild infraction.
You can say heart attack.
Heart attack. The good news is there's medications that they can treat it aggressively now, which is what they're doing, and the doctor can see everything online.
The fact that people now with the Helo app have access to their information is, again, another level of healthcare.
Just knowing that Helo is allowing my doctor to see what's going on in my life right on his computer, and then when you get an email from him, you know he's looking at that, and it's like you're being watched by the doctor at all times.
And if there are issues, at least he can address it. I'm grateful for that.
We're able to follow information, actual data from patients when they're not in the office. To see the effects it had on him and his care was fantastic.
I've had other friends that also have had some health issues, and they're asking, what's a watch like that do? And you can pull your phone out and press on the app on the phone and show all the information that now your doctor can see, and they're going, wow, I wonder if my doctor's office offers these types of things.
So Sam, at this point, I think we'd like to take a few moments and have some questions from some callers.
That's exciting.
Hi, my name's Nicole, and I work for an organization that's considering adding dental services for a variety of reasons that I don't have to go into now. But my question is, does eClinicalWorks have any kind of capability for dental practices? It would be really great to have something within the same system that we could use.
Oh, absolutely. I know 2 years ago we did not have capabilities for dentists to document all the dental information within eClinicalWorks, and we found a lot of our federally qualified health centers that are offering medical, dental, behavioral health services. And they started asking us, why can't we build a dental product for them, which is integrated within their medical documentation. And we've been successful in that initiative, and today, as you see the federally qualified health center landscape, we have more than 60% of those health centers across the country use eClinicalWorks EMR. And many of them have started using our dental solution along with their medical care using the same product. And they don't have to log in and out, and they have the entire dental chart, and they can take care of what happened during that dental visit. And when we, towards the end of 2015, we realized that we can offer this to freestanding dental clinics. And we created a new program inside eClinicalWorks, a new business unit that is focusing on dental clinics, and we've been very effective in the last few months of launching this, and we do anticipate a tremendous growth in that vertical in 2016.
Hi, my name is Jessica. My question is regards to telehealth. The prospect of offering telehealth is overwhelming because when it was first being introduced, it was very expensive in terms of equipment and infrastructure. What's eClinicalWorks doing to change that?
Well, let's look at what happened to the cell phone industry. In the early 90s, you bought the cell phones, and it used to be this big of a phone, and you probably needed two hands to kind of talk or the cell phone. And that has changed today as you and I see how smartphones are getting utilized. The same thing has happened to telehealth industry in general. You don't have to worry about spending millions of dollars to start its telehealth services. eClinicalWorks has simplified this entire experience, and a patient and the physicians just need a browser running on their device, and as long as they have a camera on both sides, they can start a televisit. So we have simplified this from a patient's point of view. When patient is on a patient portal trying to schedule an appointment with a physician, there'll be options for a face-to-face visit or a televisit. And if patient chooses the televisit, a physician will get notified on the office visit schedule. As a result, when physician starts that visit, the doctor will be able to see the patient and on the right-hand panel as the doctor is going through the documentation. The exciting thing here is it's not just a face-to-face interview online. if patient enters any information online, or if patient has a wearable device, has provided some information through the Hilo app, the physician can download that information into the note, and that is giving the ultimate experience to the physician, and physicians will not find a difference treating a face-to-face encounter versus a telehealth encounter.
How's it going? My name is Peter from New Jersey, and during the keynote at the last national conference, eClinicalWorks mentioned that it's opening international offices and dedicating attention to overseas projects. What about the customers here in the United States? Are you guys doing anything to improve your ability to help those clients that are based here in the U.S.?
Let's talk about our international story. We just opened an office in UK, in London, and primarily we see in the international market, hospitals are adopting technology, and we have more than 50 hospitals that use our hospital management system, which is going really well and growing really well. But we haven't slowed down the growth on the physician market in the US, and we just bought a new building here in Massachusetts, which is twice the size of the building that we are in. We're excited about that. We plan to add another 1,000 employees in that facility, and you might be asking, what are we up to with new 1,000 employees there? Well, we want to bring the inpatient technologies to hospitals in the United States, and we have started working with some hospitals here in US who are interested in working with us in the early stages of building a hospital inpatient EMR or acute care EMR, and we do see eClinicalWorks playing a big role in the next few years in that space as well.
Well, Sam, I think we're going to wrap up here with a question about the hot topic on everybody's mind, and that's 10E.
Absolutely, yes.
10E being the big thing coming up in 2016. Tell us about that.
First of all, when you start 10E on your laptop or any device, you can use any device, by the way. You can use a MacBook, you can use a Windows laptop or a Chromebook to access 10E. That in itself is spectacular. When you start 10E on your personal device, you'll be like, wow, the user experience is going to be amazing. You will see a consistency and end user experience very similar to the way you use modern tools on your personal device. So and what we have done in 10E is to kind of bring everything that we have done over the last 16 years, the technologies for providers, patients, and population, all available through one single user interface in a consistent way. Let's take a scenario where you want to start using telehealth services. It is embedded and integrated into 10E platform. You want to start doing some HEDIS reporting and other type of analytics with the data that you have. It is embedded right inside 10E platform. We are very excited about this 10E initiative in general, and I'm sure all our customers are going to be thrilled using 10E platform.
Well, Sam, it sounds like you've got a lot on your plate. We're going to let you go, get back to all those things that you've mentioned. And thank you for joining us on this episode of the eClinicalWorks podcast. Furthermore, don't forget to check out our other eClinicalWorks podcast episodes on YouTube, iTunes, and my.eclinicalworks.com.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.